This is the first of a Hawaii Pacific Health webinar series that we plan to host for the community. We understand that during these times, many face great uncertainty and are seeking support. All of us at Hawaii Pacific Health are here to serve as a support system for the community and to help answer questions during these times of uncertainty. We're very lucky to have several experts joining us today who will provide their insight on strategies that parents can utilize to support the health and well-being of their families. So I would like to first introduce our panel. First, we have Dr. Beverly Shea, a pediatric psychologist at Kapiolani Medical Center, where she provides therapy and cognitive testing for children, adolescents, and families, inpatient and outpatient. Welcome, Dr. Shea.
Thank you.
Next, we have Dr. Jennifer King, a pediatric and adolescent sports medicine physician at Hawaii Pacific Health who sees patients at Kapiolani and Polimomi. She is one of 8 providers at Kapiolani Bone and Joint Center, and she serves as division head of pediatric sports medicine. She is medical director of the Comprehensive Concussion Clinic and rotation director for pediatric sports medicine for the John A. Burns School of Medicine. Welcome, Dr. King. Next, we have Dash Corp. She is a clinical dietitian specializing in adult and pediatric nutrition at Kapiolani Medical Center. She teaches patients and families how to achieve their unique nutrition goals across their lifespan. Welcome, Dash.
Hi.
We're glad all of you could join us today, and we have a lot of questions that have been submitted by our audience and by some of our staff. So I'm going to go straight to those and just ask a couple of general questions first of all. There are a lot of changes happening in families and in schools as a result of the coronavirus pandemic. We're seeing that children will be interacting with smaller peer groups. They'll be in ohana bubbles. They'll be wearing masks more often, and there will certainly be a lot more screen time in their lives as interacting online. Let me ask, first of all, Dr. Shea, how can parents cope with some of these changes and mitigate some of the health effects in their families?
Sure. So there are a lot of changes. I will also say that there is also a lot still unknown as well that can also be very scary not only for our Keiki, but also for the whole family as well. And I found that probably the best way to help manage these changes is to try and formulate some type of control for you and your family within the home. And I found that coming up with more structure and routine within the home has been highly beneficial, not only for the Keiki, but also for parents as well, too. Just as we all manage this irregularity unknown altogether. And I found that structure and routine not only has to focus necessarily on learning in school, but it could also be around meals, activities, waking up certain times of the day, nap times. But also when it comes to implementing structure and routines, there also has to be amount of flexibility that happens with that as well. It can change day by day, so it's okay to have some flex, but definitely I find that creating routine and structure within the home is probably the most beneficial.
So routine and structure with some flexibility as well. I think that's great.
Yes.
Dr. King, let me ask you a similar question. How do you anticipate that all of these changes will impact physical fitness and our ability to keep our kids active?
Right. So I think initially with the stay-at-home orders, it was really hard to get kids physically active because we couldn't even go outside. Now that we can go to the parks and go to the beach, that's a great way to integrate some physical activity. There have been some of my patients that have been doing Zoom workouts at home, but we know that that's still not quite the same push as they would really get as far as doing a structured practice with their coaches. So going back to sports, I think the 2 key things for parents to remember is that they really shouldn't go from 0 to hero, meaning that they can't be expected to go back to the same level of activity that they were doing prior to the pandemic. Also, just kind of looking at what the risk is for each individual sport is very different. So just to stratify the risk within the sport, but yet give the kids a chance to be active, because especially for kids that were involved in sports before, there is such a social and mental component to their athletics that it is important to get them back, but we just want to do it as safely as we can.
That sounds great. Dash, I'm going to ask you a similar question. What do you think the impact on health and nutrition will be, and how can we mitigate some of that?
There's definitely been an impact on nutrition for sure. As the beginning of the pandemic, we all stocked up. I know I did too. So there's tons of goodies in the pantry and in the refrigerator. So I think right now it's really important to think about getting back to that routine that Dr. Shea mentioned and just trying to have more balance in our meals too.
Great. I know we'll talk more about this in detail. You know, I think we've seen a huge impact on just the social structure and the social relationships with our children. They're having to do a lot more online. They're talking more on Zoom. They're using social media a lot more. Dr. Shea, how can we help our children to integrate socially but still maintain a safe physical distance?
Sure. So there's been not only a change in kind of how we do our everyday activities due to this pandemic, but also just our way of communicating and still feeling connected, not only to friends, but also to family members as well. I would say that, you know, we can take advantage of what technology has to offer. And in terms of screen time, just making sure we have those breaks in between as well, just so we don't get so overfloated by a lot with the screen is really important. Still sticking to that structure and routine. And then also just, I think reassurance comes a long way when it comes to making sure that we still feel connected with one another, reassuring our keiki that they are still being heard, that they are still being cared for, that we are all still here for them is going to really kind of maintain that relationship too.
I think those are great suggestions. I think we're all kind of trying to adapt to those changes, both as adults and children. Dr. King, let me ask you another question too. There's been a huge impact on school sports, and I think parents are looking for ways to safely keep children active, and you mentioned a few of them there. What's the current situation with school sports, and what's appropriate, or how can we safely allow children to participate?
So, hot off the press today, the Hawaii High School Athletic Association has allowed for air riflery and bowling to start in the fall as planned. And currently, football is held off until January. And then we will see what we do with the other fall sports. So, the remainder of the fall sports were considered too high risk to start, which includes cheerleading and girls volleyball and football and cross country as well. I think with cross country, it was more managing how many runners typically go into a meet. And so, because of the higher risk, they just decided to delay those sports indefinitely for now. High school sports are a little bit easier because there is a governing body. Youth sports is a little bit harder. We don't have one body that helps to kind of give instruction to the coaches and the officials for the youth sports. So, for those, Aspen Institute actually has a great guideline for each individual sport and what the risk is depending on what they're doing. But the biggest thing is keeping communication open with those leagues and those programs to make sure that they're doing everything they can to try to mitigate the risk, but still get the kids back to activity.
That sounds great. You know, I know that sports are an important part of physical fitness, and not all children are going to be able to participate in them this year. What are some examples of activities that children and families can do together to help keep us all physically fit during this time?
So it's very interesting because many people really think of, oh, if I'm physically active, it means I have to go to the gym and do an hour workout, or I have to go running for half an hour. But in reality, it really is just moving your body. And we have, you know, beautiful everything around us. So we can go for a hike, you can go to the beach, you can go swimming. So even things that keep you moving on a regular basis is more important than trying to figure out, okay, well, when can I go to the gym safely again to do my X amount of workout? It really is just getting up and getting your body moving.
Great, and I know that's all going to help us with my next topic. Dash, a lot of families are concerned about the COVID weight we all seem to be putting on as a result of this thing. Uh, so I've heard the saying that we lose weight in the kitchen, not in the gym necessarily. What can we do to help our children not put on too much weight while they're in front of the screen and resist snacking? What are some good ideas that parents can use for healthier meals, both at home and at school?
Good question. So I've definitely seen this with my patients as well, and I get a lot of questions about this. So I think getting, mentioning that structure too, that's really helpful. So starting out with a good breakfast in the morning is definitely key. I know a lot of kids are probably sleeping in a little bit later than they did before. So getting in that good breakfast routine can really be helpful. And then as far as specific foods that can help with breakfast, making sure that they have some protein in the morning, that can actually help them make them feel fuller longer. So that really helps with controlling cravings too. So a good example would be eggs or Greek yogurt and having that with some fruit or some nuts to go along with that, or some peanut butter with their pancakes can add a little dose of protein to it too. But just getting in that breakfast routine really starts the day off right. And then moving on into lunch and dinner, having more of those home cooked meals, trying to add in, good portion sizes of complex carbs. So that all that is basically like your brown rice, your whole wheat bread. Those fibers and those complex carbs will definitely make them feel a little bit fuller longer. And then pairing that again with that protein, whether it be a good sandwich or having chicken or fish or something like that with their complex carb can be really helpful for making them feel a little bit better throughout the day.
Very good. Now, of course, if children need to have a snack, what are some examples of healthy snacks they can have in between without putting on too much weight?
Good question. So fruits are always my good go-to for snacks because it satisfies a little bit of that sweet craving, and they're really easy to pair with some good proteins too. So whether it be nuts or cheese or peanut butter, those are great snacks to start off with. We want to try to push our focus away from some of those processed goods that we've been stocking up on this pandemic. I know a lot of families have been doing that. So trying to get away from those quick, convenient type foods and try to get back to more like whole food sources because those fibers and those foods are definitely going to keep us fuller longer.
Yeah, I think the ramen and the spam disappeared pretty quickly, but that's
Yes.
not what we want to be living on, right?
No, those are for
Um,
emergency times.
that's right. Let's save those and try and keep our kids healthy. Um, Dr. Shea, there's been a lot of social change, and as a result of the lockdowns and the restrictions, families are spending a lot more time together than they're probably used to, which means they're in closer quarters. They're having to be on the screen a lot more at home. How do we mitigate that situation and help improve the social dynamics of the family while children and parents are at home together?
Sure, sure. So what I've seen in my patients is, there has been some families who's really taken advantage of this time of really just kind of like spending time together. They've built their communications together really well. But then on top of that, you are spending a lot of time with each other, and sometimes that can lead to arguments, right? Sometimes that could lead to miscommunications, kind of misunderstanding one another as well. As I've kind of like, as we all gone through this pandemic time, I really kind of focus on the home as, it's been created as your own personal bubble in a
Hmm.
lot of ways, right? And so, as you said before, dynamics has changed within the home. I think probably the thing that should be focused on the most is the communication you have with your family in the home. A lot of times you try to change others' behaviors, you try to input a certain type of routine or on somebody else in your home, and that can also backfire in a lot of ways. So it really comes down to having consistent family meetings within the home, checking in with one another, asking how everyone is doing, making sure they feel validated and heard. If there's concerns, coming up with a family plan on how to address that together, see if there's a way that things can be adjusted within the home. One of the biggest things I've seen is a lot of times boundaries within the home, personal space has been crossed over in a lot of ways for others, and that's when they can kind of clash. Maybe there might be another discussion on how to maintain those boundaries, allow more personal time, but also maintain the family time as well. So I really think the number one thing is the communication, consistent check-ins on a daily basis as a family. That will really help the home dynamics.
It's funny. I was used to when my kids were younger, having them fighting over space on the couch. Now they're older,
Right.
they're doing the same thing because they're home so much together. And one thing we found is again, as Dr. King said, let's get them out of the house, do
Mhm.
physical activity outside. We're not restricted in Hawaii to staying indoors. So as long as you're
Right.
being socially distant and safe, get outside the house and do some activities too.
That's true.
Um,
Yep.
there are opportunities, and I think there are some plus sides that we forget. The whole COVID situation has allowed us to spend more family time, and if we're careful, we can turn that into quality time too, which is
Mhm.
great. Um, Dr. King, let me ask this. What can we do with our children under these circumstances to try and reduce their risk of injury during the COVID situation?
So this again is my whole mantra of the zero to hero. So we should expect them at this point that if they're starting to return to some kind of organized activity, it's going to take about 4 to 6 weeks for them to reintegrate to get to the point where they were pre-pandemic. So that is just something that parents and the athletes should keep in mind, because sometimes they're just so excited to be back and to do things that they really will try to go full speed before they're ready to. And then the other ones are just kind of the things that we normally would have done when they first started to learn how to navigate playgrounds and things like that. So we wouldn't have them try things they haven't done before without either some coaching or some supervision, even if they're really excited to try new things. So my son decided that he wanted to learn how to ride a skateboard, but his helmet was too small. So we had to wait until we could get a helmet that was the appropriate size for him. So little things like that can help to mitigate some of the risks.
I think that's great because we worry about deconditioning when the youth are at home. And so we want to get them integrated into sports and activities as much as we safely can. Let me follow up with a question for all of our panel. I think one of the biggest fears parents are facing right now is how safe is it really for kids to return to school? And I think you each have a unique perspective on this. So maybe I'll start with Dash. And from a nutritional perspective, whether children are eating at school or taking meals from home, what are some of the risks that they face and what can we do to help keep children safe from your perspective?
Well, of course, starting off with good food safety practices, so making sure that they do wash their hands before they eat the food too. But then going back to school, this gives them an opportunity to have a little bit more structure in their day. And a lot of times at school, that's where they're going to get a really good balanced meal. They're going to get their fruits, their veggies, their milk. So even if they get school lunch, that will give them an opportunity to really round out their nutrition. And then as far as planning from home side, if you're sending your kid with a home lunch, then it gives you a chance to pre-pack that and have that ready to go. So I think having that structure really helps, and then that helps keep them nutritionally safe. So keeping their immune system strong and everything too.
And both as a follow-up for you and Dr. Shea, one of the traditions of school that we all grew up with is eating lunch with our friends. How's that going to be impacted under this situation?
Sure, I can attest to that. That definitely has been a concern brought up by some of my child teenager and also parents who are affiliated with me, just because that is one of the main types of relationship building times within the school system, and that's going to be very different. And the way that I try to address that with my families is, be honest, informative, and supportive of your keiki during this time. Let them know ahead of time what changes to expect before they get into the school system. And then also just asking, other times throughout the day they felt they made positive connections throughout the school. Not necessarily just focused on the lunchtime, but like how, like seeing, connecting with their teacher, right? Just that kind of interaction, being able to just be in a room with other peers. So helping them kind of redirect towards other times other than just the lunchtime time is also really good for their connection with peers as well.
Yeah, this is going to be quite an adaptation for all of us because many of the
Right,
ways children are used to connecting at school are going to be radically different. Um,
sure.
Dr. King, another one of these is going to be recess. For children who are used to getting up and running around and playing together at recess, how is that going to change or be impacted under the current situation?
Right. I think that that is going to be very school dependent, one on how much area they actually have outside to utilize and how they can cohort those children. So in reality, when we're talking about returning to school, the DOE is really trying to create these school Ohana bubbles, right? Where they keep similar students in cohorts together. So if those kids are together all the time, then it seems feasible that they could be outside running around during their period of time. I do think that every school is going to look different, but it sounds from what I hear that they're trying to stagger a lot of the recess periods so that the kids all have an opportunity to go outside, but to kind of keep them in their own cohorts so that one, they are still with the same people throughout the day, but two, in the event that there is an infection, that they can rapidly kind of isolate that cohort from others.
Well, and one thing I want to point out to our participating audience is, nothing's 100% safe. Everything we do in healthcare is trying to balance risk versus benefit. And so returning our kids to school does include some risk, but also not having them go to school creates additional risk of its own. So everything that's been recommended by the Center for Disease Control and the Department of Health is to try to mitigate or reduce that risk. So I wanted to ask an additional question. So our schools have given parents the opportunity to do online school completely. In other words, not have any students actually at school. Now, of course, that's going to impact both their physical activity and their social activity to some extent. What thoughts do you have for parents who choose to do online school only in terms of how can they, first of all, Dr. Shea, improve social interaction and keep kids engaged with a group of friends if they're doing homeschool or online school?
Sure. So when we come to online school, that means that a lot of social interaction, a lot of connections with their peers are going to be happening over the screen, right, over face to face. And that's going to be a different type of communication and relationship bonding that they are used to. So I think parents should really have an open conversation with their kids about how things have changed, but also kind of game plan with them too on maybe some opportunities over the weekend, like how you mentioned, Dr. King, about getting outside, some other relationship building activities they can do outside of the school system as well, and kind of have them something to look forward to. But also, I am a fan of check-ins with your Keiki as much as possible. If they feel like they are not having that connection, if they feel like they are feeling misheard and misunderstood, especially with their peers, having them be comfortable with you as a parent for them to come and pose that concern to me is going to be the number one main thing to build before even the school year starts, really. So I really think that one, making sure that bond between you and your child, that relationship is strong. Two, having them look forward to activities with friends, relationship bonding events outside of the school systems, like a school setting is going to be really good. And then three, there are going to be different types of communications that happens with online learning. I think encourage them to use their voice, the audio, to speak up in class as much as possible. I think it's going to be really, really good to also uphold too.
That's great. Literally find their voice.
Right.
Dash, I wanted to ask, since a lot more meals are going to be had at home, whether you're just, as a family eating together or preparing meals at home, or if you're doing home-based school, how can mealtime and meal preparation be used as an educational or social opportunity to help our children?
Yeah, there's a lot of opportunities there. Now that we're cooking more of our meals at home, this is a really great time to get them in the kitchen, put them to work. So there's a lot of great age-appropriate videos on YouTube to teach them how to make some simple meals, or at least get them involved with maybe some kitchen tasks. And kids who are more involved in the kitchen tend to eat healthier too. So they're more willing to eat what they cook. They're more willing to eat the vegetables or fruits or try new things. So definitely, if you have a picky eater, this is a great opportunity. And with all the fun things you can do too by gardening and having more outdoor, they can see the vegetables grow and then learn what it does when it, incorporating it into a meal too. So I think there's a ton of great opportunities here.
And then a question for all of you. Again, a lot of parents are asking, since my children aren't getting as much social interaction at school, how safe is it to invite friends over or let them meet with other children at home? Or how can we give them face-to-face social interaction but still reduce the risk of virus transmission? Let me ask Dr. Shea first.
Sure. Yeah. So I think, and Dr. King posted this too as well about having a certain amount of interaction. Definitely, like, there's going to be some limitations, restrictions. I'm a fan of having activities outdoors. I think that's going to be one, really good for their health, two, reduces risk in a lot of ways. And I do think, there has been a shift in communication with FaceTime, right? And gaming systems as well. And so I think incorporating as much time as possible outdoors with friends, right? Also keeping tabs on just which friends kind of they're interacting with too will kind of help maintain that safety. Also having communication with friends' parents too about maintaining safety is also going to be really important. And one of the things that I've done with my patients too who is interacting with their friends is they model with each other, like practice washing hands. They give each other gifts on certain type of masks too. So they're really kind of just adapting to the times.
And I think it's also important to remind our children that social distancing, maintaining a physical distance is still safer, even if you're,
Sure.
just hanging out with each other.
Mhm.
Dr. King, what are your thoughts? Who can I let my children play with? How many, how often, in order to try and maintain both their social and physical health?
Right. So technically, as of last week, we're back to groups less than 10, right? So we're kind of bound by that regulation initially. But also, if you have the opportunity just to have a little extended family, for some families, it might just be their cousins. That is someone they see on a regular basis. And other, like two families may come together and then allow their children to play with each other on a regular basis, just to have some social interaction. And again, like Dr. Shea said, if we can get them outside, get them to the beach, get them doing a hike, then that's least amount of risk for sure. But even if they're in a big open field at the park running around, that's much less risk than all sitting indoors and playing video games. So those are the kind of things to kind of think about. And then also, I have found that with the socialness of video games, not all electronics are created equal. So some electronics are really good into building and maintaining relationships. We've had a lot of FaceTime play dates, which have been really fun as well. So there's a lot of creative ways that we can leverage technology to our benefit, but then also leverage the fact that we can go outside every day.
Well, and I think the key thing our audience needs to understand is that social distancing doesn't have to mean social isolation. There's still opportunities for both face-to-face interaction and electronic interaction. If we mix up those activities, we do them outdoors, we limit the numbers of people and who our children interact with, we are selective and create our own Ohana bubbles that they can interact within, or small family group activities. There are ways to help our children grow socially safely. So thank you. I think those are fantastic. I have a couple more sort of general questions from our audience that maybe we can help answer a little bit. What are the symptoms that parents should be looking for to understand when children maybe shouldn't be going to school, and what can they do if a child becomes sick? Dr. King, do you have any thoughts on that?
Well, this will be an interesting experiment because we know that especially kindergartners and preschoolers, they probably average 12 to 15 colds a year the first year that they return to school. So then how do you figure out if this is COVID or is it another type of viral infection that leads to cough, cold, fever, like most respiratory infections do? So there's going to be a little bit of a learning curve, I think, as we get kids back to school. But the biggest thing is that if they're sick, just keep them home, right? If they have a fever, if they, are coughing or complaining that they don't feel well, then it's better just to keep them home and err on the side of caution. I think prior to the pandemic, some parents would have felt comfortable saying, well, try to go to school and see how you feel through the day. And then if you don't do well, then just have, go to the nurses or the health aide, and then you can call mom or dad. But now in this period of time, I think we have to be really aware of doing that health check with our kids prior to the school day starting. And if they're not feeling well, just keep them home. And then you can always reach out to your PCP for some guidance about should they return? Should they come see their PCP? Should they go to a respiratory clinic? So there's lots of options to figure out what to do when they do get sick. But I think keeping them home initially and then contacting the PCP is key.
Well, and I think this is a bit of a shift in our thinking as parents, and something we need to keep in mind. Just because a child doesn't have coronavirus doesn't mean they should go running back to school. And not every child who gets sick needs to be tested, because even if they're tested, we still wouldn't send them running back to school. The key is if a child is sick, they need to stay home. and they need to stay away from others until they're better. And the family needs to be careful as well. A family doesn't necessarily have to quarantine unless someone has a positive coronavirus test. But certainly if a child gets fever, chills, body aches, and especially if another family member comes down with it, you might consider testing. But for the most part, again, there is no real treatment at this point for coronavirus. The treatment is isolation and keeping people safe and away until they can heal and supportive care. Dr. Shea, any thoughts or comments on that?
Sure. No, I think it's definitely going to be a huge shift. I will say that, as parents have been starting to monitor their children more often about their physical symptoms, that it can get parents' anxiety up a little bit more about always paying attention and to monitoring their child. But the way I always put it is that it's better to be always safe, right? And whenever you have any doubt in your mind, go ahead and, like Dr. King said, contact your PCP, your pediatrician, just to make sure you get your answers heard. And I think as a parent, there's go with your parent gut too with it too. If you feel like that your child is starting to have some symptoms, right? And it's your child best in a lot of ways of what appears normal and what is not. If they're just starting to have different types of like sick symptoms, I think it always is safe to keep them home. And the same goes to adults too. When they're sick, stay home from work.
Right.
That kind of goes the same way too. Same rule for kids.
Yeah,
We tend to tough it out.
Yeah.
interesting too.
And I
As we
think
learn
the
more,
audience should be aware. Go ahead.
I was going to say, as we learn more about coronavirus, because I think we're continually learning more and more about what the virus can do, it seems that there is, for some populations, a higher risk of it affecting the heart tissue. So the American Society for Sports Medicine just put out a statement that if you're COVID positive with no symptoms at all, so if you were tested because a family member was sick, you should not do athletics or physical activity for 2 weeks. And then if you have symptoms with a positive COVID testing, then you're probably going to be out for at least 4 weeks, depending on how you do with the illness as well.
That's good to remember. And I think there's a lot of fear in the community because there's so much that we don't know about coronavirus, but yet there's a lot we've learned about how to keep people safe. So key points I think for our audience to remember is if you have a sick family member and their symptoms seem to be mostly cough, cold related, even a little bit of fever, they can safely rest at home and be treated at home. However, if more family members get sick, or if the child doesn't look normal. In other words, they're really down. If there's any question about whether they're breathing or wheezing or not eating, or even before that, you need to call your primary care doctor. The other thing is we can do a lot of treatment and evaluation over the phone and even by video now. We have a pediatric coronavirus clinic. We have ways to assess patients even without bringing them into the doctor's office. So you may not need to bring them in, but you definitely want to contact your PCP or your pediatrician. Furthermore, once you've been evaluated by phone or even by video, we can refer you for testing at a drive-through center where you can go and get tested there without having to go inside a clinic. So we have much safer ways for addressing potential coronavirus risk than we had before. And there's a lot of easy ways for us to help keep people safe and let people know if they need to be isolated, if they need to stay out of sports, if they need to not lift for a while. Dash, I wanted to throw a question your way there. If somebody is staying home and they're sick and they have a fever, what are some of the things parents should be doing to keep that child well hydrated and well taken care of while they're ill?
Yeah, definitely. So making sure that they stay hydrated. So even sports drinks can be super helpful here because it does have a little bit of sugar in there to give them a little bit of nutrition, and it really helps bring in more of that hydration too. So offering them what they can, offering bland foods too might be better. So whether it be just some of their like bland comfort foods like rice soups or chicken noodle soup, of course, is a classic one. But just trying to feed as much as you can and have those snacks. So maybe that's not the time that you have to focus so much on the healthy eating. So they can at least get a little bit more of those comfort foods in that they might be willing to try. But then I was going to say too, I mean, having the vitamin C rich foods would definitely be helpful there too. So any of the citrus and things like that can definitely boost their immune system.
That's a reassuring message. As parents, we can actually cheat a little bit when the kids are sick. I think
Yep.
that'll make all of us feel a little bit better. We have a question from our audience about uh, the equipment that we use that helps keep our children safe at school, masks and face shields. And so first of all, what are the effects of wearing a mask all day long? Is that detrimental in any way? Can anyone think of any risks, or what's the importance of mask wearing?
So
I'll
it
ask Dr. King first. Or
Sure. So it seems that there have been some good studies that show that masks do prevent viral respiratory transmission, right? So it is really important to kind of have them when you can, especially for the older kids, because they're old enough to be able to wear the mask. Downsides to wearing the mask, the biggest thing I've seen that pops up on a lot of blogs is the mask knee, right? So there might be some more acne related to wearing the mask all the time. So there are some tips and tricks to try to prevent that. But aside from that, it's not detrimental to your respiratory system or your heart system to be wearing a mask for that long.
and it's definitely the safest way to reduce the risk of transmission in the community. Any thoughts on face shields? Better, worse, helpful?
So with regarding face shields, I know a lot of schools have talked about utilizing face shields in the classrooms. Whether it's some kind of eye protection, such as eye goggles or a face shield, I think the biggest thing is to remind the kids not to put their fingers in their eyes. So either one should be beneficial, but it's more of a physical reminder for them not to touch. And we do know there can be some transmission, droplet to the eye, which is the reason why we initially started to wear them. But when we talk about the kids, I think most of it is just to physically prevent them from touching their face.
Yeah, I think what I would like our audience to understand is the big risk of transmission with coronavirus is all about droplets. It's as if you took a spray bottle and sprayed it in the air, or if you've ever been to the mainland when it's really cold and you see your breath, that's that viral plume that might contain the virus. And so as long as you're far enough away, nearly all of that will fall to the ground. And if you wear a mask, it keeps it from transmitting very far at all. So really the distancing and wearing some sort of a barrier, especially a mask between you and other people, is what's going to reduce that transmission within the community. And so that's encouraged even while students are in school. At least maintaining a safe distance, and certainly a distance with the mask, is probably better. We have a couple of other questions from our audience that I wanted to address here too that I think is great. One question here is, do we need to be concerned about children's vision with an increase in screen time? What thoughts do you have on that?
So that's my 20-20-20 rule, right? So a lot of the ophthalmologists have kind of talked about this, either whether it was on social media, but in any kind of screen time, and this goes for adults too. So right now we're probably breaking that rule because we're at 37 minutes. But technically every 20 minutes of screen time, you should take a 20-second break and look about 20 feet away. And for that, it's mostly for vision health, because we know that the screens aren't super great for your vision. And then definitely as it gets closer to nighttime, you want to shut down that screen time anyway. And that's for all ages, because you want to make sure you get that good restorative sleep. And if you're on your screen up until the time you hit the pillow, then you're not going to sleep very well because your brain is thinking that it's supposed to be awake. So I think the breaks throughout the day and also shutting it down at night will help a lot to kind of help with all that increased screen time that we're doing now.
Well, and that's true for us adults as well as our children. Let me ask another question for Dr. Shea that we have from our audience, which is, how do we deal with the issue of fear? A lot of kids who've seen all the news reports and they hear these things, and even parents, they're scared to go back to school. How can we reassure our children and even some of our parents about whether or not we're able to do this safely?
Right. Yeah. No, that has been a big topic coming up with a lot of my families is fear, right? And that can be a sense of, that comes in part with these feelings of nervousness, worry, and anxiety that pops up. And the way that I like to address this with family is, once again, let's come up with a plan of how to talk about it as a family. And I found that a lot of this fear comes from kids and teens engaging more in social media, being exposed a little bit more to kind of the news, looking at numbers, hearing stories from other friends and families. And I think it's really important to, one, validate their feelings and concerns. Let them know you're hearing that they're getting scared about things. Two, it's important to find out what they know. right? Ask them, what are you hearing? What do you know about COVID? What do you know about kind of how it's affecting community? And then I think it's also important then to state simple facts, like what is COVID, letting them know it's a germ that gets you sick, what types of like sick symptoms will you experience, how it spreads. I like to explain it to my Keiki patients, like it's a really tiny germ that you can't see, right? And that's why we got to wash our hands really good, right? Because a lot of times they think COVID, they think it's something really big, but really I try to say it's just a little tiny germ you can't see. And this is why we're all doing this. And also letting them know what's being done, right? What's being done as a family to keep them safe, what's being done in the school system to keep them safe, but then also asking, what can we do to make you feel safer as well? So that's kind of how I addressed fear for Keiki and also for family members. And a lot of them it finds that it helps kind of mitigate that in a way.
I think that's great. And my own thoughts on this too, based on what I've seen with my patients, are just a reminder that, not all situations are the same. Certainly families that have older parents, grandma, grandpa living at home, mom and dad have diabetes, need to take probably more precautions than some other families. And we're also looking at risk in the community. We talk about the numbers of people who've had coronavirus, but the real issue is how much is active in our community. And as the activity level goes up or down, we are adjusting our response to that. So if the activity level of coronavirus in the community becomes very, very high, then there's going to be both a government and a school and a social response to that to try and keep the community safer. If we're very successful and we're socially distancing and wearing our masks and we're able to control it and reduce the threat level, then we'll be able to ease back a little bit. But what we're really doing, again, is managing risk, because by far and large, the majority of people who become positive for coronavirus will not get seriously ill. But what we want to do is really protect those who will. And with that thought in mind, a question we had is, what do we do for our special needs child, someone who has an IEP, Down syndrome, who have either special learning or physical disabilities? How can we help them succeed in this environment and also keep them safe?
Mhm. Yeah, yeah. I can kind of speak a little bit more on that too, because there has been a lot of questions, especially as kids are reintegrating back into school, about how do we adjust the IEP? How do we adjust the 504 plan? I think it's really important to make sure you continue having those meetings as much as possible. I know some of those meetings are happening over Zoom. See how it's being updated, how it's being implemented. See how structure and routine is being implemented within the school as well, preparing your Keiki too. And then when I talk about preparing, I'm not necessarily just talking about before school begins. I'm talking about even just every morning, reminding them kind of what that structure routine is going to be looking like. Because what I find with children who have special needs, especially from a mental health perspective, is transitions are really difficult. And now it's going to be even more difficult, as now we're not sure exactly how this transition is going to change or how it's going to be different. So I think that it's really important to really just kind of prepare with school staff, school officials, and try to make sure that there is some type of routine and structure implemented at the school for them.
Thank you. I think that's very, very helpful. Dash, I have a question for you. One of our audience members asked, are there any particular nutritional supplements or things that might help our children during this time in terms of keeping them safe or reducing their risk?
So there's no there's no specific supplements that have been shown to help with COVID, but there is a lot of research happening right now. So some of the top 3 things I think nutrient-wise that were most beneficial is vitamin C, vitamin D, and zinc. So I always recommend a food first approach. So making sure that you have a balanced diet so you don't have to worry about taking extra supplements to get these nutrients in. So some of the foods that would be best for this is going to be eggs, meats, nuts, yogurts, things like that are real nutrient dense, and that'll help round out and actually get most of those 3. And then also having the fruits, so your citrus fruits, or even if they're not a big fruit person, tomatoes or tomato sauce can be a great way to get some extra vitamin C in. But if you find that your child is a more picky eater, maybe doesn't eat as many of those foods, most children's multivitamins will have those 3 nutrients in them. And you don't need to take any extra large dose of any of those either. But having I think starting with the food first approach, and then if you find that just on a daily basis, you know, he or she is just not getting in enough of those fruits or vegetables, or not eating a ton of meats, a good multivitamin can be a good backup.
Yeah, I'm a big fan of making sure we use food first and pills second. You know, even supplements and vitamins and things are artificial, and they're produced in a factory, not in nature. And so as much as possible, I like to see us treat our children with food and variety. And we're fortunate that right now we do have access to a variety of food in our stores and everything's functioning well. And even though we should all keep a little extra food on hand just in case, right now we have the chance to create meals that are nutritious for our children at home, and the schools are also preparing nutritious meals they can eat as well. So yeah, I think that's a good way to look at it. Um, I had another question about what can we do for children who are extremely scared, don't want to go to school because of what they're hearing and seeing on the news. This is sort of the extreme cases maybe. What can we do to help those children, or is there a different approach? Should we consider a different way of helping them? Dr. Shea.
Mhm. Yeah, I know that this has been a topic too as school is approaching more, and I've seen it come in the form of questions from kids too, of like, when is school going to start? What's it going to look like? And things like that. I say in those extreme cases, when we start to get into more of that school avoidance type of behaviors, I think it's important to maybe start rehearsing, coming up with what the routine looks like with going to school, right? Start practicing that now, right? What the routine looks like with coming home from school too. And part of that routine, and I'm always a fan of this, is incorporating good coping skills for them, incorporating kind of what we call kind of age-appropriate cognitive behavioral therapy type of strategies to kind of target those fear cognitions that comes up in our Keiki, hearing what exactly those cognitions are, where that cognitions, what's the source that it's coming from, trying to challenge what may appear somewhat irrational. And I like how you put it, Dr. Glenn, of like, what can we do to make them feel safer too? It's all about reinsurance and feeling safe, because I find that a lot of those fear cognitions comes from Keiki who feel like they don't exactly know what they can do, a loss of control of what they can do to feel safe. So coming up with a plan as your parent to your child of exactly what they're going to be doing to keep safe, what the school is going to be doing to keep safe, is going to be really good to help curb that school avoidance behaviors.
Yeah, all children need healthy coping strategies. We're going to have
Right.
to deal with fear in different ways. Exercise, social interaction, reading. There are different things we can do that help us deal with fear and the stress and the adrenaline that comes. And if we can teach our children those early on, then they'll be able to cope with other fear-based situations as well. Had another question from our audience. What if you're a teacher? Now, how can you stay safe, and what are your thoughts on how our thoughts on how teachers can stay safe? I'll ask Dr. King this as far as while they're at school.
Right. So I think a lot of the teachers are looking at their own risk as well, because as you know, we do have a pretty good population of teachers that are older, which puts them in a higher risk category, or they might have other comorbid diseases too. So it's the same as we would recommend for everyone else in the community. It's lots of hand washing just whenever they're touching surfaces, making sure they're trying to be physically distant whenever possible. And then when they cannot, to ensure that they are wearing the proper PPE, whether it's a mask or a mask plus goggles versus face shield. So I think that's probably the most important thing for the teachers as they start the new school year. And then secondly, of course, the same as we mentioned for the children, that if the teachers feel like they're sick, then they should also stay home, right? So not to try to feel bad that the kids are going to have a substitute, because I know a lot of teachers feel really connected to their kids and they do feel bad when they miss going into that classroom setting. But for now, it's just safer to stay home if they're sick, whether or not it's COVID.
Very, very true. And I think teachers are certainly as concerned about going back to school as the students are and the parents are too. Um, Another quick question, I'm going to follow up on this, Dr. King, and that's hand hygiene. We talked a lot about masks, we've talked a lot about shields, but when children are in school, they're going to have to take their mask off to eat, and maybe for other situations. How can we make sure that they're doing this safely? And how would you describe the proper process for removing a mask and putting it back on?
Right. I think Dr. Shea touched on this really well too, and a lot of it is just practice to make sure that they know how to do it before you send them for their first day of school. So the biggest thing for kids is if they can just try not to touch the mask, if they can learn how to put it on and take it off with the elastic bands on the side, that's the best way to do it, right? And to kind of fold it in half so that the outside surface is what touching the surface where they are. And then the birthday song is still the best one as far as washing their hands, right? So when they get the soap and the water going, they should sing that happy birthday song. My kids put their name in because they think they're going to get something every day. But if they learn to do that, then that's the proper amount of time. And all kids know that song, so it's pretty easy for them to do that. And then the hardest part is for them to not touch their face while they're eating. So that's a lot of coaching. So I think like Dr. Shea said, if we can practice some of these at home, right? And then you can even make it a contest if you have multiple kids and say, okay, whoever touches their face the least gets like an extra serving of dessert, right? Something like that, that can motivate them to start to learn those behaviors. If athletes can do it as far as touching their hands to the face and retraining themselves, we can do it for the kids too.
Yeah, whoever doesn't touch their face during the meal gets the first to get ice cream or something like that. You know, I think we forget sometimes that a lot of this is change. It's not necessarily good or bad. It's how we cope with it and how we deal with it. We can make it fun. We can make it entertaining. And especially as adults, we can model this for our children. I think there's a lot less fear if we do a little bit of gamification and we make it fun and we have some contests around it, and let kids design their own masks and design their own containers to keep their mask in and make it a little bit more interactive and fun rather than a fear-based thing of, oh my goodness, we have to do this or we forgot to do that and don't touch this. There's a lot of don't and be careful about. Instead, it should be, hey, let's all do this together. Let's be safe together, and we can sort of promote this in a way that children actually feel safer and more comfortable. It's more about the feeling we create than anything that's actually happened. Wouldn't you agree?
Yes.
Let's see, let's take another question from our audience here. And this question is basically that the students are all going to be in group bubbles, and ideally they're going to be sort of sharing the same germs, if any. What can we do in these, what kinds of behavior, and we've talked a little bit about hand washing, we've talked a bit about mask wearing. What else can we do in these Ohana bubbles to reduce the chances of virus transmission? I'll ask Dr. Shea that question first.
Sure. I think that, a lot of times, and that's true, right? From a parent perspective of you're going to be interacting with these kids every day, there's multiple exposures. And I like how you said, Dr. Glenn, to make it come into a fun activity as well. I've had patients come up with socially distanced friend handshakes or things like that, little mini dance routines or things. I think it's all about, as I said before, we just need to adapt, right? And one of the things that I've also like to say to my Keiki too is that this is all temporary for the time being. Right? This is something that we are all adjusting to. I also have some of my Keiki patients speak to their friends about it as well, openly, with parent monitoring sometimes as well. But I think there are opportunities to build a different type of communication and a different type of social interaction as well. It's all about being creative with your Keiki about it.
It is, and I think we sometimes forget that as children are very sensitive to the adults in the area. If
Mhm.
we're afraid, if we're scared, if we're acting like everything is something that we have to be afraid of and our children need to be scared, they're going to be scared. But if we act like this is a situation that we can manage and we can even make it fun, and even though the things that we did last year, maybe we can't do quite the same this year, or maybe we can't do them at home quite the same way, let's do some new things. Let's create some new routines. Let's create some new traditions for our family and for our children. Let's do things in a different way. Let's invite friends over and play in a different way. Let's do more outside. We can create routines that are not fear-based, that are kind of fun-based. And I think that really is the biggest challenge for us as parents, is to teach our children how to adapt to this in a positive way. Dr. King, how is PE going to be different if it exists at all in our school systems?
So I haven't heard a lot about the PE plans. I know that there is planning, but I'm not sure what they're going to do overall. It seems like most of the schools are doing the same as far as the cohorts. So they're going to keep them in the same little Ohana school bubble, and those will be the kids that do PE. They're going to try to do mostly outdoor activities just because inherently they are much safer as opposed to doing a weight training course where they're all not only inside and poor ventilation, but all touching the same equipment. So they're going to gear more towards fitness activities outside. So PE will look a lot different just because there's going to be a lot of changes with what they're able to do. Over the summer, I know that there was a lot of opportunities for some of the schools that still offered PE for the summer credit. They did a ton online. So they had, different YouTube videos, different workout sessions, and they did a pretty good hybrid from the patients that I talked to that did it. So I think there is an opportunity to leverage that as well if they want to hybrid some at-home activities and then also some activities within the school PE program.
Yeah, I think there's a lot of changes, and those are opportunities to try and make it better and safer for everyone. I had a question that I don't know the answer to. Are we recording this, and it will be made available? So there will be a link, and we'll let you know what that information is. Let's see. We have time for just one or two more questions here, and I'm just double checking to see what our audience has submitted. This one I'm not sure I know the answer to either. Will schools be doing music and band?
So it's interesting. I was on the National Federation of High School Sports, which also covers band and music. They're doing a study right now as far as vocals and wind instruments on if they actually use a mask along with a protective cover on the instrument, how much less respiratory droplets go into the area, which was really interesting. I hadn't heard that before. So it sounds like from practicing as far as the string instruments and percussion and piano, that those are something that's fairly feasible to do in small groups, again, in their same cohorts. But I think currently right now, things like marching band aren't ready to happen. And then we'll see with the study from NFHS if they can actually go back to some vocals and some wind instruments too.
Thank you. And I know there's a lot that we still have to learn. So this is a very fluid situation, and the challenge is what we know today may change a little bit tomorrow. We'll try and squeeze in just a couple more here, and I think this is a great one. What do you do if your kid comes back COVID positive? How do we deal with it at that home, both physically and socially? And what if the child wants a hug, right? How can we manage a child who is COVID positive at home? Dr. Shea, your thoughts?
Right, right. And this has also come up with some of my patients too, whose family members have been exposed as well, and there's been needing to have somewhat of a quarantine process. Once again, it kind of stems from that fear, not necessarily, and this is one of the things that comes up is this fear of loss, also bereavement, but it comes in a different form with kids. Sometimes they fear the loss of the relationship, the contact, the attention, right? And so I can see that kind of falling into this realm, right? When, for instance, a kid comes home positive, that's when the fear starts to happen, right? I think that it all begins with how us as parents react, right, to kind of this situation. Kids thrive in a very stable environment. They also look to parents on how to respond to certain fear situations as well. So reassuring the kid that we are still on this together, for one, let them know what are the steps next that we need to take, right? Also letting them know that everything that's being done is just to make them healthy again. All right, that's another script we also need to say. And then for kids who we do need to kind of fade back a little bit more on that interaction, try to find other activities to make sure that they still feel that interaction. Once again, being creative about that, but also verbally reassuring that you still love them, right? That we are still here, I think is going to go a long way.
Yeah, and I think with younger kids, there's just going to be some risk of exposure we just have to deal with. They should
Right.
wear a mask if at all possible. We should keep them isolated in a room. Absolute careful hand washing. but there is some risk of exposure, and we just have to work through that as a family. I think one of our tendencies sometimes is to treat these positive cases as pariahs and like there's something wrong with them. There isn't. It's a situation we need to manage, and we need to manage the fear. Ladies and gentlemen, thank you all so much for participating. I think that's all the time we have for questions today. And I want to thank our three panelists, Dr. Shea, Dr. King, Dash, for joining us. And we really appreciate your insights and the information that you've given our families. We hope everyone in our audience was able to take away some helpful information on how to keep your Keiki safe during this time. As you've heard throughout our program, Hawaii Pacific Health offers comprehensive services that support the medical needs of you and your family. From virtual video or phone visits to in-person care, we're here to help keep Hawaii healthier. If you have any questions regarding our services or today's webinar, please contact events@hawaiipacifichealth.org. Thank you all for joining us today. I'm Dr. Dale Glenn. We hope you stay safe and healthy.